finding vitality because she happened to open the door to Chiropractic Family Wellness Center and asked the question, can I be helped? And she found that journey.
Hi, I'm Dr. Meg. This is Dr. Carroll. We are the chiropractors at Oasis Wellness Partners here in Scarborough, Maine.
We would like to talk to you today about what is chiropractic, some misconceptions. We're going to talk about some success stories and just clear up some information about how chiropractic can serve others in our community. Chiropractic is a triune. There are three parts to it. There's a philosophy, a science, and an art. Chiropractic was put on the science books in 1895, and the work that we do is an art in that you go to school after college and you learn the art of what we call adjusting or analyzing the nerve system to see about interference to growth and health. The art part is something we are always refining, always doing our best at learning how to be the best at it. It's something we work on every single day. Different chiropractors will have different art, just as different nurses have different ways of doing techniques. So chiropractors have an art, and a specific art of chiropractic is the one that Dr. Meg and I do together. And the philosophy of chiropractic, the biggest part of it that I believe is so paramount is that healing comes from above down, inside out. That your nervous system is where your health lives, that it controls your body, it's the master control system of your body, and that no tissue in the body is able to live healthfully unless it's connected to the nervous system with a full 100% inborn innate intelligence flowing to it. That's the philosophy of chiropractic, that's the paramount paradigm that we start from and work from always. The science part of chiropractic has been around since 1895. There is so much information and science about how the body heals, about how the nerve system and mental impulses control the systems of the body, digestion, cardiovascular, immune system, all of it. All three parts of chiropractic are what Dr. Meg and I practice every single day. We make sure that we are working with all three of those, and as we educate and help people to understand how their body functions and really come to understand what their body is talking to them about every day, what the symptoms they're having mean. A symptom like chest pain could be about your heart story. It could be about anxiety. There's so many ideas. And in chiropractic, we're able to have that dialogue with the body and have the system be able to come to a place of homeostasis, stasis, and healing.
There is a great book called The Reality Check. And if you want to learn more about the science of chiropractic, the practice of chiropractic, I highly recommend that book. It's written by a PhD who is a chiropractor, and it's also written in a way that anybody can understand it. So I recommend that as a resource for you if you want to learn more about chiropractic. I also want to talk a little bit about a couple of common misconceptions that we hear a lot in our office and have heard over the past 30 years. One is that chiropractors are back pain doctors, and that is true to an extent, but that's not the full story. Pain gets relieved with the chiropractic adjustment. I think if you've ever experienced good chiropractic, you've had that experience. But the job of a chiropractor as we practice it is to allow your body to function more fully and for you to be a healthier person throughout your lifetime. Chiropractic is about function, not necessarily feeling. Although, as I said, you're going to feel better when you get adjusted. That's just a really happy side effect of the work that we do. Another misconception that we hear a lot is once you get sucked in, you're stuck and you're going to have to go forever. And so I want to address that because that's a really common misunderstanding of the work that we do. The idea of being under chiropractic care and staying under chiropractic care is always a choice, just like we have the choice to get up and do some exercise every day or not, or get up and eat well or not. And we know that if we do make the choice to eat well every day, or as well as we can that day, and exercise that day, our body's only going to be better for it, and we're going to be better for it. Chiropractic is similar to that in that you don't have to do it every day, but if it's part of your wellness regime, if it's part of what you do to take care of yourself, you're going to be healthier and you're going to be more resilient. You're going to recover from injuries faster, and you're not going to be as prone to being injured when you're getting adjusted consistently, and your immune system's going to be stronger. So those are all the things that we know are part of having chiropractic as part of what we do to take care of ourselves. The frequency is something that varies individual to individual, and it changes as when you're a brand new patient or if you're someone who's been getting adjusted for 30 years. Those are very different places in your chiropractic journey, and so the frequency is going to be very different to match that. Those are two really interesting, I think, misconceptions, and hopefully that's cleared that up for you.
I want to talk a couple moments about some success stories and just bring to light some of that idea that Dr. Meg just talked about. We have an amazing practice member who, for a very large part of her life, maybe 20 years, she was told over and over and over again with changes in her inflammatory processes and in pain most of the time, she was told never to go to a chiropractor. And now under care with us, in a very short period of time, her body is functioning at peak performance, she's having days of ease, she's being able to have her workouts, having better body functionality and image. She never knew that was possible. And she questioned, because she is a seeker of truth, she questioned with us, why would that happen? And you will hear that. You will hear people say, I wouldn't. But that's a very, very, very old story based on ignorance, based on people not knowing what this work does. There's plenty to read about and to know that those stories are so old that now there's more information, and I know you all are very privy to information. Get on those stories, like look into that book, that reality check book, and understand that those parts of those stories can change. That woman is finding vitality because she happened to open the door to Chiropractic Family Wellness Center and asked the question, can I be helped? And she found that journey. Another quick story I want to tell you about is about a little boy who came in, and he was in with his family, who is about 6 or 7 years old, and he was born with a rudimentary kidney. So you have 2 kidneys in your body. One side was fine in his body, the other side they found out he didn't have one. It was a small little rudimentary kidney that didn't function. And at a certain age, he was told to go back to the medical model and see if this was causing irritation to his body. He might need surgery to have it taken out because it wasn't normal. He began care with us, and after 1.5 years, he was ready for that special appointment. Got nervous, would talk about it in his adjustment appointments. I'm going soon. How do you think I'm doing? And I'm like, your body's great, your body's functioning, you're doing great. Your body's doing just what it needs to do. So he went to his appointment and came back running right past the front desk, didn't wait to check in, went right back to the adjusting room and said, guess what? It's growing. My kidney is the size of a peach. Since then, that boy's been under care for another 2 or 3, well, probably 3 or 4 years. Time runs for me, but 3 or 4 years. He's now a teenager. And he's asking questions every time he comes in. Do you think I've had enough water? How does my body feel? I'm drinking much more water. How do you think I'm doing? We're coaching him. We're helping to know the potential. His nervous system opened up with his adjustment. He has a supportive family. His family knows it's important for him to keep his nervous system clear, stress-free, and come in and get adjusted. And he's seeing those changes. Those are the kind of stories that we see on a regular basis. But what's really interesting about that is there are stories we don't even know is happening in your bodies. We just know you're at peak performance, adapting, as Dr. Meg said, to all the stresses in your life and making sure the cells stay healthy on a regular basis.
Thanks for tuning in, and we look forward to seeing you again.